25th September 2016. This 6 years old, male-neutered Persian has a history of vomiting for the last 2 months on and off. You can see he has also running nose and the ears are very dirty. Now I've seen the history. Last 2 years, the urea and creatinine levels are high and it's higher than normal. And palpate the abdomen, the kidney seems to be smaller and slightly painful. So this vomiting could be due to kidney disease. So we are doing a blood test and give a IV drip or subcutaneous 200 ml, and the blood test result will let us know whether his kidney is failing or not. So that is the situation with this. Now you can see that he's been scratching his ears and it's very dirty. Although the groomer is supposed to groom him, but had not done the ears, so it's very dirty. You can see it's very dirty, and these are all scratching due to ear infection. The cat is scratching with the legs, and so it's not a skin disease by itself. So now we will take the blood to confirm that there is kidney disease by checking urea and creatinine levels. In the last 2 years, in February 2014 and September 2015, the levels of creatinine had gone up, and the owner did not feed the cat KD, and so most likely now the kidney will be even worse, and so we have to see before the results. September 26, 2016, Persian cat with vomiting for the last 2 months on and off, sometimes food, sometimes hairball, sometimes nothing. Today is what date? 28 September 2016. The cat has recovered from kidney failure. Now, okay, I'll bring back. Now we discovered that he sleeps in the washing machine area, so that's why the chemicals poison him and poison his kidney. Poison his kidney. Now this Persian cat can get kidney disease easily, part of the breed. Now the owner carries alright. He doesn't scratch the owner. Now he's only 6 years old only, right?
6 years old, okay.
6 years old only.
Go back bathe for him.
Give a good bath, but away from the washing machine. Washing machine. Then wash the ear, the skin disease. We give the wash and then put the cream. And this is okay, good. Go back already.
September 2016, Topayo Vets. This cat came in 2 days ago with a complaint of not eating for a few days, lethargic, and vomiting for quite a lot of times.
Okay, this cat is a Persian cat and is 6 years old, male, neutered cat. Now, this cat had a history of blood in the urine earlier on in 2014. Then he recovered, and then after that, in 2015, okay, we look at the history of the blood test. In 2014, his complaint was blood in the urine. Okay, he was treated. There was no complaint anymore. That is February 2014, and then in 2015 September, he came in for vomiting and sneezing, and recently, this is 2016, about 2 days ago, he came in with the same complaint of vomiting and sneezing. So now we have taken blood tests for the 3 visits, so we have a history. Now the history of vomiting is one of the symptoms, signs and symptoms of kidney failure, although many people think it's due to gastric or food poisoning. So the blood test is the evidence. Now you can see it from the evidence of 2014, the urea was high, 13 as compared to maximum 10.8. And then the creatinine, that is more important measure of urine kidney failure, was 176. Now the maximum is 160. So this one was a mild kidney failure in the sense that it's not very high. Then the owner was given antibiotics and he didn't come back anymore. And at that time the platelets were low as well. So these are the three things, evidence of kidney failure and probably some toxicity, or because the total white cell count and red cell count is normal. So now we concentrate on the kidney profile. So in 2015 September, we did a blood test and you can see urea is high and creatinine is high. It's a bit higher than the previous year, the previous blood test. So anyway, these are the signs of kidney failure. And of course there was vomiting and sneezing. And again, total white cell count, red cell count are normal. So we don't suspect bacteremia. Now, last 2 days ago, he came in again with a complaint of vomiting and sneezing, lethargic and not eating. So based on the previous history, I took a blood test again, and you can see urea is high, a bit high, not say very high, and the creatinine is also high, a bit high. So there's a good chance that this cat can recover from kidney failure. So we give a dialysis, and at that time he was very weak. So he wasn't like now, where he's trying to attack me. This is the fractious cat. When he recovers, he has this reaction. So now what is the recommendation for the owner? So to prevent further kidney failure, I normally recommend the owner to give a kidney diet, KD for cats, and starting with the can first, the can one, and of course plenty of water to drink. Now you can see that this is the best recommendation, and many owners in Singapore, they complain that the cat won't eat it, and it's true. So how to make the cat eat this? What we do is we mix what the cat eats normally is this fishy canned food, okay, or what he's been eating. This one, the KD, normally I would recommend 100% of this canned food plus 1/4 of this KD. KD, mix it thoroughly. Now, in that case, you cover the KD. So that's day 1, day 2, day 3, day 4. Let's say you add a bit more. Then by the time maybe 1 week or 10 days later, the cat has switched over to KD. So with the cat switch over to KD, then of course the medication is put in here, antibiotics is put in here, and painkillers put in here, because this cat definitely is very hard to syringe unless the owner can give it by syringe. Now after mixing this, we will give it to the cat, and obviously the cat may not eat it. You can start with not necessarily 25%, you can start with 5% or 10%, but the cat, since he has recovered, he will be eating his canned food. Now I will try and put it in, but because this cat is now he has recovered, and he will be trying to attack me. So that is the situation. I'm trying to distract him to come here. come here so that I can put the food in. He likes to, he's not stupid, so now I'm trying to put it in. Now, the trouble is, when you put it in, he will attack me. So, it's pretty difficult. I just throw it in. Well, he didn't attack me, so that's good. Now the cat does not eat one whole lot like the dog, so you might see that he's not eating now because he has just eaten early on. And there's plenty of water, and he goes home today. Now we can't give dialysis to this cat. Normally we give 3 or 4 days of IV drip to flush out the kidney poisons. But since this cat has recovered, so he is not going to tolerate us touching him. So he'll go home and will probably ask the owner to syringe the water, to give him more water to flush out the toxin in the kidney. Now the low platelets could be due to toxins or due to something wrong with the system, the blood system. Because thrombocytopenia, there are many causes. Now there's the sneezing, upper respiratory tract infection could be due to his poor immune system. It's hard to say. But anyway, as you can see, he's very active now, and he's famous for being fractious when he's well. So this is a sign that he's very well. He's very well, and that's good news. Now the kidney failure is not a serious one. So if the owner does not want to continue the KD, then most likely the problem of vomiting and lethargy will come back again, maybe a few months later or what. So our advice is just to advise the owner. We cannot force him to do it. But the main thing is to switch over. You have to give at the beginning 5%, 95% old food, probably the fishy type, the canned one. Then the next day maybe 10%, then 15%, and 20, then 25, and so on, until maybe 2 weeks you switch over the KD, and then with this KD, then you mix with the wet and the dry KD because it's cheaper, and then make sure the cat has plenty of water to drink if possible. Syringe it. Let's say you do it 30 ml per day. I mean, the owner may be able to do it. And monitor his urine. Now there is no X-ray done, so to save costs, so we didn't do an X-ray. But whether he has bladder stones or kidney stones, we don't know, because sometimes it's difficult to do X-ray due to financial reasons. So we will have to wait and see. There is possibility of bladder or kidney stones in this cat because he's 6 years old. And but the blood test evidence is the best because it shows that liver is okay, glucose is okay, white blood cell is okay, except platelets and the urea and creatinine. So the diagnosis is kidney failure, and he has been given a subcutaneous drip to flush out, and he has definitely recovered with the vitamin B's and glucose. Now he'll be back. They'll be going back today, and there will be, hopefully that the owner takes the recommendations. Okay, thanks.